Good afternoon, everybody. Dr. Reed here. Today, we're going to have a very interesting conversation about depression, and more specifically, a specific type of depression. This type of depression is called a dysthymia. And what does that mean? A dysthymia is this glooming feeling, this glooming, smoldering sense of sadness and depression that goes on for at least 2 years. And there's no real appreciable break in that depression. However, the depression isn't severe enough to be admitted to the hospital or result in the person wanting to harm themselves or anything like that. It may simply result in the person experiencing that life is much more complicated to get through on a daily basis. They may feel that it's an uphill battle and that they definitely have burdens to bear and to carry. So dysthymia is a type of depression. So we're going to be talking about that today, Elisa. And so how you doing, buddy?
I'm doing just fine. This sounds very interesting.
That's great. And so we're going to talk about the assessment and treatment of dysthymia. So it's going to dysthymia is not a large topic in and of itself. So I just want to review a few things about it, and then we can sort of move on. But here I just have Chat GTP.
So it's basically
Explain.
a type of depressive order, right?
Yeah, it's a type of depressive order. Now, remember, you represent the lay population, right? So
Yeah.
you come from engineering. If you have any questions about these, please feel free to ask them because I'm sure the other listeners will be very much interested.
Sure.
So, explain dysthymia. So, starting here, let me see. Yep. So, dysthymia, also called persistent depression disorder, depressive disorder. It's a chronic form of depression that lasts for the last at least 2 years, right? At least one in childhood or adolescence. While its symptoms are generally less severe than major depressive disorder, they are more persistent and can significantly affect quality of life, relationship, and productivity. I think this is one of the things I was trying to express too. So it's not as severe enough to make a person want to end their lives, or it's not severe enough to make a person get hospitalized, but it can have a significant impact on almost every part of your life.
So it has opposite aspects. So at one side it's like less severe, but on the other hand it's like very persistent. So opposite aspects.
I know, and then the challenges it can cause can be very difficult because if you start to feel a type of depression with the symptoms are such that you can't perform at your same level at work,
Right. So
then
it's basically more long term, like in the long like in a way it's more long run, right?
yeah, because 2 years of it. Can you imagine feeling depressed for 2 years? Uh,
Absolutely not.
that's to meet the criteria for the diagnosis. Doesn't meet the criteria for the diagnosis. It's tough.
But that's a lie.
Okay, yeah. Core features. Okay, duration, depressed mood most of the day, more than not for 2 or more years. Look, severity, symptoms are milder than major depression, but long lasting, like we just said. The course is chronic and insidious, like we just said. Patients may describe themselves as being this way. Did we send the link to the students in the student group?
Hmm.
Let me see. We sent them the link.
Let me just check.
Mm. No, okay. I just sent the link to the students. And then I'm gonna send the link to the stage also. Great. Okay. So you can see chronic and insidious. Right? Diagnostic criteria. During the 2-year period, 2 or more of the following must be present: poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, low self-esteem, poor concentration or difficulty making decisions, feelings helplessness. Right. Now here, the individual has not been symptom-free for more than 2 months at a time. That's awful. To feel depressed for years and only have a break of 2 months of feeling normal. There may be episodes of major depression, such as double depression.
Oh, that must be awful.
Yeah, so one of the things I do as a psychiatrist is I focus mainly on the ego, and
Oh,
the ego is the network or the programming. It's the index that codes everything around you, right? That's why we can label everything, right?
I have a very irrelevant question. Not very irrelevant, but like I just want to ask you, what disorder do you find the most fascinating? Like not fascinating, but like the most intriguing when you study it?
The longer I practice medicine, the longer I realize I'm coming to the conclusion that mental illness doesn't exist.
Oh, that is a very interesting take.
I'm a psychiatrist. I don't know if I should say that out loud.
Yeah. I mean, what makes you say that? What makes you say that?
Okay. So let's say that if a person had a head injury and injured a part of their brain, now their brain don't work as well. Yes, it does work well. It's working well despite the injury. Why compare your current status to where you were previously or where everyone is at?
I mean, mainly because that was how you were born. That's what you possessed, right? From the beginning.
Mm-hmm.
Yeah, you continue, yeah.
Okay. Okay, I think the orientation is off. Okay, so they say you have a deficit because your brain isn't working the same way it was working before the injury, right? But the brain is working the best way it can.
Right, yeah.
Okay. This applies in this example. Let me take it to another example. That's an example: somebody's in a car crash, and it's obvious. This person who's been depressed for 2 years, what if they're married to a sociopath?
Oh.
Right?
Yeah, that is, yeah.
Right? And when they come in saying they're depressed, I'm saying, well, is something's wrong with you? Right? But then if you look at the other way, well, shit, your body is acting normally. This is how bodies behave when you're exposed to sociopaths. Ain't nothing wrong with you. And get away from the sociopath.
I mean, I'll give an example. Like, these are just disorders. But like, what about the schizophrenia or dissociative identity disorder? Like, those are very. I cannot say that their brain is working more with them because those are very. I don't know. I find them very fascinating.
Yeah, and they're very complicated people too. I mean,
exactly, yeah.
They are very complicated people, and they recognize that they're complicated.
Indeed, I mean.
Go ahead. People but you see what I'm saying though? If the disorder isn't clear, or if it's created by someone else, or if it's reported by someone else without any evidence that's there, see, they can say you have a mental health illness. They give you a diagnosis, but can't really describe what they're talking about.
Oh, yeah, that's something I really actually pondered over. Like, I do actually think about that a lot because you cannot like live it firsthand. You just hear it from someone else, so you can't really ever know what actually it feels like.
Yeah, and then there are other things like there's other things, like there's a humans are made up of cartridges, right? It's like
All
four
right.
four main cartridges, right?
Mm-hmm.
And this is really deep in the psychoanalytical language. So that's why we know it's valid. There's a term called extroverted sensing. Let me let me show you. Um, okay, explain Carl Jung's, let me say, theory on personality types and extroverted sensing. Let me see if we can get a definition for this extroverted sensing.
Oh.
Okay, look, so Carl Jung's theory of personality type is one of the foundational frameworks of modern personality psychology. His ideas later inspired the Myers-Briggs personality type. And let me tell you this, Elisa, you gotta do this. You gotta do this personality type today. I've never found anything more true to life than this.
I have actually done that. I have actually done that.
Oh, oh, you would. I would have known. You would have known that. I didn't know my personality types until I was about 40s, and you learned when you're five.
Well, so what's your personality type?
Girl, you wouldn't guess. You wouldn't guess. You would guess. What's yours?
Hmm.
What's yours?
I'm INTJT.
INTJT.
Yeah.
INTJ.
Yeah.
Wow. I'm INFJ.
Oh, we're kind of close.
INFJ. Right?
Wow. So
And
you lean
so
more like. Mm-hmm.
I got both. I got both on my functions. I just happen to be very rare. My functions are dominant, so I'm a T and a J. So
Yeah. So.
I'm turbulent. I'm turbulent at the same time on a focus on justice, right?
So you'd say you're more emotional leaning, right? Because
See,
S and G and F. So you have feeling in your MBTI.
extroverted. All right. Okay. So yeah, I'm really a okay. I is for introvert. I'm an introvert. Okay.
Yeah, you are introvert. Yeah.
Okay. So we'll get to the personality because hey, listen, we're very similar. I'm gonna show you how this works. It's amazing. But I wanted to show you this one concept here called extroverted
Yeah. Sure.
sense.
Sure.
Here, extroverted sensing here. Okay, and I wanted to show you a reason why it'll be hard. It's hard to understand if you're having any type of negative moods or emotion. It's hard to even understand if they're yours.
Yeah. True.
So it may not be yours. You may be simply absorbing the energy from the environment, from the people you're around,
That's
right?
some physics right there. Yeah.
And then you say that you can absorb the energies and emotions of the people around you, and people think, okay,
Mm-hmm.
okay, that's not true. But I'm gonna show you the technical psychoanalytical term for it, and it's called extroverted sensing. So there's a lot of
Mm-hmm.
research and a lot of stuff that goes into this, and this is psychoanalysis. So, okay, Jung proposed that the human behavior is driven by psychic energy, which can flow in two main directions, right?
Mm-hmm.
Or attitudes, and operate through four main functions: extroversion, outward towards the external world; introversion, towards the internal world. Let me tell you
Mm-hmm.
something. This is a very interesting dichotomy now, because I'm going to tell you something. I'm going to give you a secret, okay?
Mm-hmm.
If you're going to focus your energies externally, you better know exactly what you're doing, because that's the seat of all of your suffering, right?
Oh
And
yeah.
the
Yeah.
key of all that growth, the key of all the growth, the key of all the growth is going inwardly and expanding outwardly for personal growth and development. So here's Jung's personality theory here. Here, Jung proposed that the human behavior is driven by psychic energy, which can flow in two main directions and operate through four primary functions in consciousness. Two is attitude, extroversion, meaning outward, oriented outward towards the external world. Your energies, introversion, oriented outward towards the internal world. This version component of the ego is the reason why you suffer. And all growth and all healing goes to shutting this channel down and redirecting all your energy towards this inner world. Right?
Very complex, yeah.
So that's how deep these concepts go. Okay, here for consciousness, but here extroverted sensing. Okay. Oh, okay. This is what I wanted to do here. Okay. Here, four functions of consciousness. You have the sensing function. This is perceiving concrete physical world, right? That's the senses. Now look at this one. This is what I wanted to show you here. Extroverted sensing. Extroverted sensing is one of the perceiving functions. So you perceive things from the environment, right? It gathers information directly from the external environment through the five senses. It attunes to what is happening right now. Now, what might happen, not what might happen later or what someone means symbolically, right? So this extroverted sensing is a way for you to receive like all the energy types from the environment you're around.
That makes sense, yeah.
And so how, if you don't understand this, how do you know, or if this is like your intuition, how do you know you're depressed? Okay, so if you don't understand that your body absorbs the energies and emotions of the people around you and you feel them as if they're yours, how do you know what emotions are really yours and what are not? And when it goes on for like 2 years at a time without a break,
that is thought-provoking.
You know, can you imagine having to live with the worst person to work with or to engage with? I can imagine those circumstances. You'll pick up a lot of those energies, and I don't think they feel well.
True, yeah.
You know, and so it's really, so here, so I wanted to bring that up, and so let me give you another example here. So this is what I'm talking about, the extroverted sensing here. Okay, so the core characteristics of extroverted sensing, because this is another one of these things where you get your intuition tells you something, and you get a gut feeling, right? That's what this is. Yeah, this stuff is real, and people need to learn how to trust these feelings because they tell you exactly what's going on. So the extroverted sensing focuses on the immediate external world, sights, sounds, textures, tastes, and moments. It absorbs it. Like perceptions, objective, realistic, and concrete. Objective. So it gives you real interpretation of your interpretation of these feelings are very realistic and with details, you know. Like the feeling was in my gut. As soon as I came into room, I felt a feeling of lead in my gut, and I felt like a rod iron in my back every time I walked around them. It sounds like that, right?
Yeah.
If you didn't know, you would probably think that you were experiencing a depression. And then there's other things connected to this is a if you're experiencing things like a dysthymia, like you depressed for 2 years. For 2 years straight, you have to look at the people around you.
Right.
You know,
the main idea is that you're skeptical about the credibility of it, right?
About extroverted sensing. Well,
Yeah.
okay. Remember, I was saying that I'm not sure if the mental. Okay. How can I treat you if I don't if you really not depressed?
Yeah.
I mean, if you look at the dilemma I'm in, right? This is what I do for a living. It's like I make a burger, but I don't know what the ingredients are to make you a burger, right? All right. So you come in and say you're depressed.
Oh.
I've been depressed for 2 years. You've been depressed for 2 years. You know, what's the problem, man? You need to be leaving. You need to get up out of here. I don't see no. I
Exactly.
don't see what's wrong with you. Like what's wrong with you? You need to stop. You need to start moving around, or it's awful. Um, and you're younger. I'm sure you're going to experience. You're younger as you live. People, many of these people who feel like that, who when they come into your life, they bring all of these negative feelings and depression and their burdens with you,
Exactly.
with,
Yeah.
with them for you to carry, and then they act like the problem was you, right? And then you're going to encounter people who actually come into your area just to destroy things and destroy relationships and connections. And this is how these people feel like, right?
Oh.
I've noticed over time in my gut, the people who make my gut turn are the ones who are actively behaving in ways that are just awful. I mean, just absolutely awful. And I've learned whenever I pick it up in my gut, I gotta keep it moving, because these people will destroy everything around you.
Exactly. You can't just give in.
Yeah. Well, okay, so that's my conversation on dysthymia. I didn't want to go too far into it, but
Yeah.
if you are dealing with things like dysthymia or anything like that, it's important that you get some help, and at least get some medications and see a therapist. But I think it's important for you to start thinking about changing your entire life. I mean, and then I think you also have to start thinking about, hey, are you absorbing somebody else's depressed mood? Now, I'm doing a series on narcissists, psychopaths, and sociopaths. And the narcissists, particularly narcissists, they get into relationships for the purpose of transferring their burdens onto you.
Right.
Financial burdens, emotional burdens, psychological burdens, and things like that. And so you end up bearing the cost for them, you know? Mm. Make sense?
It does.
Let's see. Okay, so I have a question here. So let me see if I have a question here. Hey, Junior, how's it going, Maxis? Um, is PDD curable? I mean, I think I'm starting to. You got to get away from people. You got to get away from people. You have to be very careful who you're around. You have to be around healthy people, because the people healthier people have the capacity to engage in a full relationship with you, as opposed to engage in a series of transactions with you, and the transactions are never satisfying. you know Meaning, is there anything that can make it go away at a certain point in your life? I think you have to just do a life rehaul. That's my opinion. You have to draw some boundaries and cut people off, particularly the people who are making you feel that way or making you have negative emotions. If you are, and this is awful, if you have a friend or things like that who basically talks about you behind your back, or causes or misrepresents you, or you have to live in their reality, that's a lot to do with depression. Or if you're in a relationship with someone who's narcissistic, psychopathic, sociopathic, you have to start looking into all those things, and things may not get better until you actually get out of those relationships. So I'm a strong proponent of people ending relationships and getting away from people. So I'm kind of less likely to prescribe somebody medications than to give them what's called a geographic cure, meaning you need to leave and you need to get around better people. You know. Okay, I think that's all I wanted to say for now. But did you have any questions for us, Alicia, at all?
No, not really.
Well, thank you so much and everything. Did you and the other guys get together, like the other receptionists and stuff like that? Did you?
Not again. Yeah, not again.
Okay, so we'll talk about that later. Okay. All right.
All right.
Take care, guys. Hope this is helpful for you guys. Read out. Ciao, guys.